Hi, everyone. Dr. Eric Westman here. Thanks for joining in on the live or on the replay. This month, I've been talking about diabetes and prediabetes, elevated blood sugars, a little bit about carbohydrate intolerance and insulin resistance. At the end of this month, April 28th, so next week, I'll be giving, April 29th, April 29th, Monday, as usual, Monday, 8 p.m. Eastern Time, I'll be giving a free workshop on how to look at the blood in terms of diabetes. So it's a free workshop. You'll want to sign up, and sign up even if you can't watch live, because we'll send you the recording, a replay afterwards. And you can go to adaptyourlifeacademy.com, click on sign up for the free lab workshop. So this month, I started with talking about diabetes is reversible. Yes, diabetes is reversible. I'm talking about type 2 diabetes, and I'm talking about most people with type 2 diabetes. In fact, in the latest study by Verta Health, in their analysis, about 70% of the people who were on insulin could get off the insulin in the first year of a keto diet, properly formulated keto diet. So this time I'd like to talk about, yes, you've done diets before, they haven't worked. Why is that a keto diet or a low carb diet can work, where a diet you've done before for diabetes, or for weight loss for that matter, hasn't worked? And that's because the traditional diet that has been taught for diabetes and for weight loss is a low-fat diet. When you think about diets, that you can think about low-fat diets, low-carb diets, low-calorie diets are the main mechanism of how you lose weight. The calories are kept low. You can count them explicitly, or you can just reduce the carbs, and then the calorie reduction happens pretty much automatically. So when you think of diabetes and prediabetes, we're talking about a condition where there's an elevated blood sugar. A doctor diagnoses the diabetes by checking the blood sugar, not the insulin, not really anything else. It's the blood sugar. Well, it might be the hemoglobin A1C, which is just a measure of 3 months of the blood sugar on average. So the blood is checked to see if you've had elevated blood sugar. So if a diet is used that's low fat diet means that it's pretty high in carbs. And carbohydrates, the sugars and the starches, are the foods that raise the blood sugar, glucose more specifically. But so you could be on a low-fat diet and actually have your blood sugar go up, even though you've been told to do this for diabetes. I've had people come to me that are being taught to eat more carbohydrates. Remember from last week, it's because they're on medication that can make the blood sugar go too low, and that their blood sugar, after being taught what to eat, actually goes up, even though it's taught to them by a diabetes expert. No, you want to eat in a way that keeps the blood sugars down. And that's why a low carb diet, or a keto diet, which is a low carb diet, can work where other diets you've used in the past, if they're low fat and high carb, hasn't worked. It turns out 100 years ago, for the treatment of diabetes, a low carb diet was used. And if you make the trip to my office at Duke, I'll pull out the old pages from the book that show from 1923, the treatment for diabetes was a low carb keto diet, kind of like the one I teach today. It's been called many things. It was called the Banting diet. It was called the Atkins diet. It was called the South Beach diet, the protein power diet. And today it's called the keto diet. Now, not all low carb diets are keto diets, but all keto diets are low carb diets. They're very low in carbs. So when I teach a keto diet, I actually minimize the carbohydrates in the foods and the drinks, so that the blood sugar will go down about 100 points, 50 to 100 points on the first day of teaching someone how to change the food this way. So that means I have to be very careful, and you have to be careful if you're on medication that can make the blood sugar come down. And I advise people and instruct them how to reduce their blood sugar medicine when they're following a keto or very low carb diet, because there's much less need for medication. And another way to think about it is, if you have diabetes, you're basically taking insulin in response to the number of grams of carbohydrate you're eating. The more carbs you eat, the more medicine you need. So when you cut back the carbs, you need to cut back on the insulin. Now, if you're not used to thinking about food, that's fine. That's part of any kind of teaching program. And what I teach is very, very basic, that you have to remember that sugars raise the blood sugar. That's pretty simple. And that starches get digested to sugars. Now, that's confusing for a lot of people. Then I will introduce the idea of restricting or lowering the carbohydrates. Then as the visit goes on, I'll also introduce the idea that that means you can't have any fruit. And then the response, no fruit. But yes, fruit is sweet and has a lot of sugar in it. So if you're trying to reverse a condition of elevated blood sugar, it makes no sense to eat fruit. And then people will say, well, but on so-and-so's diet, they allow for the fruit and the berries. And no, not on a prescription strength keto diet that reverses the diabetes and obesity and all the myriad of other things that are caused by those foods. So it's very different than a low-fat diet, or even what's called the Mediterranean diet today, which is very much higher in carbs than a low-carb keto diet. And what's different in my approach and other doctors that use the method I use is we take control of the medication and the food from the same time. So at the same time. So I can instruct you to lower the carbohydrates in the food, knowing the blood sugar will come down, and I instruct my patients to lower the medication at the same time so you don't get any low blood sugar spells. Now, so remember that if you've never done a low carb diet, that means I ask people not to have things like potatoes. And you might say, well, a potato is so different than sugar. But remember, the starches get digested to sugar. In fact, the digestion starts occurring in the mouth with saliva. So as you chew, the starches start to get digested to sugar, and the starches get absorbed as sugar. Now, you can test this out, or you can trust me, or test this out on your continuous glucose monitor if you have one. A lot of people now diagnosed with diabetes are given not only the finger sticks to measure blood sugar, but they're also given the continuous glucose monitor. So you can check the blood sugar before and after eating a potato, or say 10 French fries, which are potatoes, and you'll see the blood sugar go up. In fact, the effect is so strong, there are some clinics, and there's a study published where they just gave people this continuous glucose monitor and didn't tell them what to eat. And the people in the study automatically started reducing the potatoes, the pasta. Yeah, pasta's on that high starch list. The rice and beans are the worst. They reduce their fruit and all of these high carb items just by following the blood sugar. I keep pointing here because the continuous glucose monitor is, about a quarter size, and people usually wear it on their shoulder. And it's painless. It's something that if you're really trying to track blood sugar, it's a game changer because it doesn't hurt, and you get a blood sugar reading just about every 5 minutes. So now what is confusing is some people can eat those high carb foods and not get diabetes. And it may even be in your same family. So I know it may not seem fair or right, but a lot of it is the genetics that we're dealt that we have no control over. So while someone else might be able to drink sugar even and not have an elevated blood sugar or diabetes, you may be not able to drink sugar Well, that's an easy fix. You just go to sugar-free things. You can have sweet things, but they're just not full of sugar. The interesting thing is some people are using language that is kind of ambiguous, like they're good carbs and bad carbs, or you eat based on a certain color of food. No, what we do in our program is we boil down, we simplify things to the number of grams of carbohydrates. And it's not net grams. That means net grams is subtracting out from the total, the fiber and the sugar alcohols. We just use the total carbohydrates. We call that prescription strength keto because it's powerful, it's stronger, it's stricter, but it's more effective. I've had some people go from net carbs to total carbs, and that's all it was needed in order for someone to get off a plateau or to start reversing the type 2 diabetes where it was kind of stuck before that. Net carbs, where you subtract the fiber and the alcohol, sugar alcohols, is assuming that those things don't affect your metabolism. And I don't want to make that assumption. If someone makes it to my office, I said, do you want to mess around with something that might not work? Or do you want to have something that works the first time, every time? And, everyone says, I want something to work the first time, every time, of course. So the problem with the low-fat diets is that the foods have high carbs. So while it's not called a high-carb diet, low-fat diets, Mediterranean diets, have a lot of those foods, the high-ticket items, the bread. No, that's right. I don't want you to have bread. I don't even want you to have keto bread. No, what I would do is teach you how to make a chaffle, which is made out of eggs and cheese. At first, I don't even want you to have almond flour or coconut flour. So these are all kind of internet keto things that really aren't strict enough to reverse type 2 diabetes in the fastest way possible. So even low-fat diets are too high in carbs, Mediterranean's too high in carbs. The lower you go on the carbs in the diet, the better the blood sugar will come down. And our study published on this was published back in 2009. We compared a low carb 20 gram per day to a low glycemic diet, which was more like 100 grams per day. And within just 6 months, there was separation in terms of blood sugar control. It didn't even take that many people to show a statistically significant difference in those people. So, but it makes sense. If eating something very sugary or drinking something sugary raises the blood sugar, you will want to choose something that's low in sugar and starch if you're trying to reverse type 2 diabetes. So that's really why a low-carb keto diet is more effective than low-fat diets for diabetes reversal, even for weight loss for that matter. It's not that they don't work, it's just they don't work quite as well. And when you want to reverse diabetes, you want to be careful to reduce and take control of the medication and reduce the medication. As you reduce the carbohydrates, the weight comes down, and that reverses the insulin resistance, which is really the second factor that is contributing to type 2 diabetes for just about everyone. And so a low-carb keto diet does both. It lowers the carbs, that gives you the immediate blood sugar reduction, and then it reverses the extra weight, insulin resistance, if that is a contributing cause for you. And that also explains why not everyone gets perfect control of the blood sugar when you cut the carbs out. If there's underlying insulin resistance from extra weight or anything else for that matter, then you'll have a longer time and continue with the diet in order to get the normalization of the blood sugar. So, I wanted to focus this month on prediabetes, diabetes, insulin resistance, carbohydrate intolerance. These are all problems on the same spectrum, on the same pathway. And having prediabetes is a wake-up call. It shouldn't be don't worry, we'll just put you on a medicine. That's what most doctors do these days. No. Take action. Many people wait until the doctor says, I have you on 1, 2 pills and blood sugar is not controlled. And so it's time for you to go on an injectable medication. No, no, no. You don't have to wait till that happens, although that's often the point at which people say, hey, wait a minute, maybe I can do a different type of lifestyle change in order for me not to go on insulin. Once you're on insulin and that perpetuates the weight gain, you're really going to have diabetes forever. And as I mentioned in 2 weeks ago, it doesn't matter if you've been on insulin for 20 years. I've taken people off insulin because no one ever taught people how to reduce the carbohydrate to the level that I do. No one ever was able to take people off insulin. So, and it's kind of shocking because 100 years ago, the low carb, high fat diet, keto diet, is what doctors used to treat diabetes before there was medication. So there's a scholarly paper by Belinda Lennertz and David Ludwig at Harvard that shows the history of the treatment of diabetes, type 2 and type 1. And there was a shift from diet to medications so that doctors kind of lost sight of using the diet and prescription strength diet. Some argue, and it was pretty much brought out in the Gary Taubes book, Rethinking Diabetes, published in January of this year, that partially because doctors couldn't measure insulin until the 1970s, the assay hadn't been developed. Doctors didn't know that people with type 2 diabetes already had elevated amount of insulin. And that's what led to the term insulin resistance. But insulin resistance isn't from this abnormality inside the cell, it's from the food and the drink. The excess carbohydrate creates the inability of insulin to work, and it causes insulin resistance. The good news is you can reverse all that just by changing the food and using a low carb or keto diet. So, well, I hope these brief sessions, I know it's kind of brief, and I apologize, I'm not getting to the question and answers tonight. The idea that diabetes is reversible is not commonly known. Now you know. The best paper to show reversal is actually the Virta Health study, the Hallberg paper. Finney and Volek are the principals at the Virta Health company. Now you don't have to do that program with all the bells and whistles. Just changing the food is sufficient. But then the idea that you're not on too much medicine, the diabetes isn't so severe that it can't be reversed. I've taken people off 400, 600 units of insulin, and they've been on insulin for 10 to 20 years. Just no one ever told them they could reverse it. Finally, the idea that other diets, I've tried other diets, and the diet that my doctor recommends, they tend to be high carb diets, which makes no sense when the problem we're dealing with is high carb in the bloodstream, high sugar in the bloodstream. So you want to gravitate toward lower carb or even a keto diet, like one we teach, if you want to reverse prediabetes or type 2 diabetes. If you want to learn more about the lab work and the blood tests, I'm doing a free seminar next week, next Monday, April 29th at 8 p.m. Eastern time. And you can sign up right now at Adapt Your Life Academy to reserve your seat so that you don't lose out. Now, if you can't watch on the live, we will send you the taped version on the replay. So be sure to sign up. But you have to sign up for all of that at adaptyourlifeacademy.com. The seminar is called Decoding Your Lab Tests. So I want you to understand it's not just the blood sugar, actually. That's spoiler alert. There's more going on behind the scenes that you want to be aware of. The insulin levels, the other factors that are at play, even when the blood sugars are mildly elevated or not elevated at all. Thank you so much for watching. I just wanted to do a brief update on different kinds of diets, and the low carb diet is really the best for type 2 diabetes reversal. And just as an aside, Last week, there was a recent paper on irritable bowel syndrome and different dietary approaches, and compared to the medication treatment for irritable bowel syndrome. Our paper was published in 2009 on irritable bowel syndrome reversal. This was a randomized controlled trial of 3 different groups. The low-carb diet won compared to the FODMAP diet and the regular diet with medication. But think of the year, it's 2024. It took 15 years from our publication to having a randomized trial validate it and compare it to other different approaches. So I never say mine's better than another. Well, other than the low-fat diet, we've done so many studies comparing that. But there are a lot of approaches that work, but this one I'm very comfortable with using, and it's interesting because when we were publishing our papers on irritable bowel syndrome, type 2 diabetes, obesity, heartburn, polycystic ovary syndrome, we were just validating the research that doctors had been using clinically for, 30 years before that. So the medical world and the research community is way behind the clinical use of these kinds of approaches. And as you probably have noticed, doctors really don't ask you much about the food, and they're very quick to go to the medication, the prescription pad. That's not my approach. It's how I was trained, but I see that you can actually reverse conditions with lifestyle change, food mainly, where medications without regard to the food really aren't strong enough. Thanks for tuning in. I hope to see you next week for the free lab workshop. Go to adaptyourlifeacademy.com right now to reserve your seat. Bye now.